What's up, everyone? Today we're here with Tavee Chin, who's a D1 at the University of Detroit Mercy School of Dentistry. We're going to learn a little bit about her journey to dental school and her experience as a first year during COVID. Thanks for being here today, Tavee.
Absolutely. Thank you so much for having me.
It's an honor to have you. So, can you give a brief description about your, undergraduate journey, like where you're originally from, where you went to undergrad, and like what your major was?
Absolutely. So I'm originally from New York, from the Bronx, and I went to the College of Mount St. Vincent. It's a very small liberal arts school, not a big university, but we're really good there. And I majored in biology. I got my BS.
Very cool. And when and why did you choose dentistry?
So how I started dentistry, actually, my mom, she's an architect. So when I used to go to her work, I would always see her touching models and things like that. So I thought, okay, like maybe I'll go into engineering or something. And when I had got my braces, actually, was the first time I had ever went to a dentist. So I was a little later in the game. So I went for, to get a consultation, did my cleaning, and I was like, wait, this profession is so cool, because it was a marriage between being able to work with my hands and being able to help. And I remember that was during high school, and I asked the orthodontist I worked for, I said, hey, like, could I come and shadow you? And I actually ended up becoming an assistant there. And my decision was very solidified once I became an assistant, and being able to interact with patients really fulfilled a part of me that I clearly love to talk. So that was something that I needed to do. And I told mom, hey, mom, sorry, not going to architecture school. We're going full dentistry.
Well, I mean, of course, like you have a way of making people feel comfortable for sure. So, but you were working at a ortho office, right? So, did dental schools ever ask you like, are you interested in ortho or are you interested in just general dentistry? Did they ask you that?
Yes, they actually did. I hopped around from a lot of specialties that I work for. So I did start in the orthodontic office, and it was a lot of, wires, brackets, all of this. And then one day my orthodontist was like, I have a general dentist in, not too far, if you'd ever like to shadow him. And when I went to shadow him that day, I believe they also had an oral surgeon there. And when I actually saw the drilling, using composites, doing all of this, I was like, his name was Dr. Kim, the orthodontist. I was like, listen, I really like orthodontics, but I think I might like the constructive of general dentistry more. So they did ask me about the transition from ortho to GP, but I think as a whole, general dentistry was kind of like the jack of all trades. So, there wasn't like a specific niche. It's one day you're doing fillings, and then one day you're doing crowns. And then there were so many different facets that I loved about it. And another thing about dentistry, if anyone else is a tech geek like me, there's always something new that's coming out when it comes to general dentistry. So that's something that I really enjoyed as well. So they more so spoke on, how did you like assisting? How did you like taking x-rays? How was your patient interaction, your chairside manner? And so that's more so what they asked about, because, when you go to dental school, you are coming out as a general dentist unless you choose to specialize. And so that's what they asked about. But I loved all the experience that I had, and I'm grateful for it.
I totally agree with you on the tech aspect. Like I was shadowing a dentist and his office had like the latest technology, like Circ machines, Atero, and like even the lights were awesome. I was like, yeah, this is the type of place I want to be in.
Right. And I feel something that's so great about dentistry too is that you do still have your bread and butter dentistry that don't utilize all of that. But once you really have a foundation, and being a D1 student and now kind of seeing it from a different perspective and not the lens of an assistant, you have more appreciation for all of the innovation that's going forward. And that's why I also love dentistry too, because you're a kind of like a student forever. There's so many CE credits you could go to. There's so many conventions where everyone's talking about 3D printing, and then they're talking about more CAD CAM, and how dentistry has really transitioned so much in such a short amount of time within the past 15, 20 years. The way that we take impressions then are not the same now. We don't even sometimes use material anymore, So that also improves patient experience, because, as a dentist or practitioner, you're excited to do these things. Your patients are like, I don't want to do this. So it's
Exactly.
great, the transition and being able to learn and be stimulated throughout your professional career.
So
profession.
I wanted to ask you a question about, your dental assisting experience. Like, how do you feel like that prepared you for dental school?
It prepared me a lot. If but from more a dexterous point of view, didactic in terms of taking like my biochem courses and exams, that was just a whole different beast on its own. I would say it helped me a lot more in my simulation lab and dental anatomy, because I've taken more x-rays than I can count, and being able to identify teeth morphology and things of that, being able to know how to work with dental material because it's very time sensitive.
Yeah.
So efficacy, because you're the backbone of a doctor as an assistant, like you're the one who's kind of handing in the instruments, being able to know what something does. However, I do feel like a lot of my peers who have never have dental assisting experience and they've only shadowed are thriving just as well. So I think it was nice to have a foundational knowledge of it, because I've taken impressions. So when we do work on each other, it comes a little easier. But what I will say, it's nice because I can help my peers. But I feel whether or not you assisted shouldn't, be a scary factor.
Okay.
I would say just do what you can, shadow as much as you can, and we know when the schools accept you, they believe in your ability more than anything. And that's true. I have most of my peers haven't assisted and they're doing phenomenal. So that's not something I would ever worry like, oh, I've never assisted before. Am I going to do well? You're going to do fine. Absolutely fine.
So can you talk to us a little bit about your DAT experience? Like, how did you study for it and how did you feel like going through that, rigorous
Absolutely.
schedule?
Absolutely. So I took a little more time to study for my DAT because I was working a full-time course load in between. Because as a lot of predents know, supplementals are expensive, applications are expensive, the DATs are expensive, the prep program. So it's like I didn't really have much financial help, so I did work full-time. So what I did was is I would work throughout the day and then I would study from 4 to like 11 o'clock. So instead of doing a traditional, I know a lot of students will take 2 months off of school, which is great, and just kind of do a full hardcore study schedule. I did around 4 months to do what I can. In the evening, I utilized DHA boot camp. I utilized destroyers, and I felt like those were the best resources that I used.
Awesome. So, um, I've heard that like with DAT destroyers, sometimes it's unnecessarily difficult.
Over
Did you feel like that was the case for you?
if I had to change something, I definitely wish I would have just done the math destroyer, not so much the biology, not so much the sciences. I feel boot camp is sufficient enough. I personally, I love science and I tolerate math. Let's say that I tolerate it. So kind of thinking I needed more exposure to more questions. So as I started using the destroyer, it when it came to doing the boot camp, I was like, okay, it's a different type of math. It's not like calculus or anything like that. It's more so, oh wow, like I haven't done this stuff since like trigonometry or geometry of that nature. So I feel it's a different way of thinking, and it did help just to kind of have a broad exposure to different types of statistic questions of that
So,
nature.
and what would you like your biggest piece of advice be for, predencer planning to take the exam? Like, would you tell them to like take the time off and like try to treat it as a full-time job?
If it is in their ability, absolutely. I feel it is the best thing mentally because you can create your schedule the way you want to. I would also say too, you are human. Go to that workout. Take your Sunday off if you need to, spend time with family. I wish I had that, but a lot of the students I have mentored before, I just tell them, treat it like a job. You're clocking in at 9, you're exiting at 6, maybe you got to do some work after, but it definitely is good for your mental and physical as well. I would always say, don't kill yourself over an exam. And my biggest advice is to be honest with yourself and patient, because everyone is different. Some people may have taking their DAT as like a second profession. You know, some people are, I have a lot of unconventional or non-traditional students who are this is like they went from teaching to dental, or maybe you've been out of school for some time. So to compare, you know, their knowledge to someone who has just taken organic chemistry, just taken general chemistry, it's not the same. I would say be honest with what you know and be kind to yourself and think, you know what, I'm going to do this. It may take me a little longer, but I would recommend taking the time off and treating it as a job.
Okay. And so I know you had a unique experience with the DAT. Would you like to share a little bit about it?
Absolutely, absolutely. So I did not, you know, I did not score a 20 AA or anything like that. I scored baseline across the board, 17 in all sections. When I first saw that score, I was like, okay, you need to retake it. And actually, I did apply. I took my DAT in a little later in July, but there is a 90-day period that you have to wait to retake. So I actually scheduled a retake for November, but I also knew in my heart that, okay, Tavee, you have been an assistant for so long. You have incredible extracurriculars. You have a great GPA. It was just kind of a flunk, more so just to put my heart on my sleeve that I have generalized anxiety disorder, and I was mitigating that through taking the DAT. So having a flare up for anyone who does have that, understanding that it is difficult. So I kind of outweighed my options and I rescheduled my DAT, but said, you know what, apply. Like, you have baseline. Maybe that wasn't the best financial decision, because it's like, why put all your eggs in one basket? But I trusted my intuition. And when I applied and in October, I started getting these calls for interviews, I was like, should I still retake my DAT? I kept the DAT date, which ended up being the end of November, beginning of December. And I won. So I took my interviews. I got a few interviews actually, and I was surprised based on my score. And for me, acceptance day was December 2nd. My second DAT was supposed to be a little after Thanksgiving, so a few days before December 2nd. And I was very confident with my interviews, actually. I walked out of all of them very proud of what I have done. I, you know, kept all the contacts of admissions. And when November 28th came, I said, you know what? Postpone the DAT for a week after acceptance day, see what happens. Because when I did my interviews, they asked about my DAT and what had happened, because they're like, okay, it doesn't really make much sense. You have close to a 4.0 GPA, you have all this experience, something must have happened. Like, and I was honest. You know, you have to own yourself. You have to be confident in who you are and don't be ashamed of your story. And I told them, you know, given living my life with a chronic disorder, I just kind of had a fluke that day. And I told them I actually are registered to take my DAT again. And that was it. I never had an admissions kind of red flag me. They kind of just, I actually had one admissions counselor say, like, you're very brave for applying with that. And I just said I trusted myself. So as I said, I postponed my DAT. It's like, okay, let's wait for December 2nd. And then December 2nd, I got a few calls and I was like, oh, I guess I'm gonna cancel my DAT because I don't need it. So unconventional story, but just to say that just because you don't have, you know, close to a 30 AA, it is not impossible. I know a few students as well in my class who have scored actually 18 AAs, 19 AAs, and I was a 17. I don't know anyone else, but I was on the lower end. But what I will say is, if you have a great score, obviously you're going to share it, you know, and there's nothing wrong with that. You put in the work and you reap, you know, the fruits of your labor, but that also doesn't mean because you don't look like that X student that you're not capable of great things either.
That is awesome. Thank you so much for sharing that. I know our viewers will really appreciate that.
Absolutely.
So can you tell us a little bit about your interview day, you know, specifically at Detroit Mercy? Like, who did
Ah,
you speak to and how did you
right.
feel throughout the interviews?
So, okay, it's so weird because it's a pre-COVID world. So I was like,
Yeah.
wait a second, it wasn't virtual. So I it was very cold that day. The interview day went from about 7 a.m. to 1 p.m. So it was a very long day. And what they actually did was they had us do interviews first, and then they had us tour the school second. But from the moment that we had the interview, everyone was so warm and welcoming. Like all of the faculty were actually laughing with each other and kind of like picking on each other, so to speak, but just to show that they're very close knit. I know some people might see this like, oh my God, that's not nice. But like for me, someone who lives in New York and someone who's so communal, like I feel like sometimes our language for friendship is just kind of being close knit and being able to see, laugh with each other and things like that. They divided us into groups, and we basically were interviewed by different professors. So I was interviewed by clinical professor Dr. Bauer. I took down her information, and the interview itself was supposed to be 20 minutes. Mine bled to 40, of course, clearly.
That's a good interview then.
No, yeah. And I will tell you, my interview, UDM's interview was the most relaxed one I went to. They really Dr. Bauer, not they, Dr. Bauer really wanted to know who I was. She asked me traditional questions, why UDM? How did you hear about UDM? They asked an ethical question in terms of, they present a situation. How would you go about that as a clinician and things of that sort? But that was probably the first 5 minutes. And after that, we spoke about being from New York. We spoke about pizza. We spoke about, I did undergrad research on fruit flies. So we spoke about research. And then she was talking about something, she's going to Aruba for vacation. And I was like, oh my God, I've never been to Aruba. So it was a very, very lax interview. And I think that also comes from showing your own comfort. So if I had to give it any interview advice, is know you have got there, so you've got here. They really just want to know who you are. You got the DAT, you got the GPA. They want to know how you fit in their program. And more so, what's important too is as a student, like being able to decipher, okay, like this staff and the faculty look very close knit. This is where I can see myself, because it's not only the dental schools want you're about to live there for 4 years. You want to make sure that you really like the program and you like the people there, and you can see what type of personalities there are. But what I would say the number one important thing for me is coming from New York, being a first generation minority student, is the diversity of the class. I went there and I saw so many people from different backgrounds getting along. All the faculty came from different backgrounds. And that's very important to me, because growing up in the Bronx, where there's like just a melting pot of so many different people, I don't mind sticking out like a sore thumb, but it also is very refreshing to see people from different cultures, different walks of life. And a lot of students that were there were like, I'm going to be the first dentist in the family. And for me, my mom was a refugee from the Cambodian genocide, and I would be the first doctor ever in this family. So for my minority students who are paving ways for themselves, it is very important to have a program that's going to support that dream, because sometimes we don't have, the connection, or we don't have, like my uncle isn't a dentist, and that's not, saying that's a bad thing, but to say that that's a level playing ground wouldn't be true either. So the faculty also told me too, that as an underrepresented student, we are going to do our best to support you. And she told me that during my interview. And that was something that really solidified my decision to go to UDM.
That's amazing. So, I mean, in addition to that, like an awesome interview and the diversity at Detroit Mercy, like what else do you think, I mean, if anything, makes it unique compared to the rest of the schools out there?
The clinical experience, 100%. Be finishing up my first year at Detroit Mercy away from COVID, because, different states have different protocols. So some schools are not in sim lab yet. I've actually been in sim lab the entire year. But prior to that, I have spoken to alum that have been at the school. And speaking to third year students or second year students, I would hear, oh my God, we didn't do endo till second year, or we didn't do, this type of preparation or this type of restoration till the second year. So it's nice to see that if the pace is good coming from New York and having like a fast pace, I wanted to have the best clinical experience. Where I feel maybe a student may not want to, if you're interested in research and things like that, maybe I'm not. So that's why I really liked the school. But I will say, although we do research at UDM, it's very clinically oriented, and they want to make you the best clinician possible, because we actually start seeing patients the end of our second year. So the summer of the second year. So they really make sure you learn your skill and you're ready for clinic. And what I also really liked to prior, I feel it's very important to speak to current students.
Yeah.
It is great. All that stuff is great. Reach out on social media. If I had a pre-dent that found me and they saw like my Instagram and saw I went to Detroit Mercy, shoot me something and ask me how my experience is there, because that is your best indicator. And what I've heard is, or what I've experienced, which was not just an alleged rumor, is that being able to do so many different procedures beyond just fillings, being in the inner city, there's a lot of full mouth reconstruction for people who want to go or maybe specialize. That's a very important factor to think about your professional career away from dental school. Is, does the location of the dental school fit what I want to do? Do I want to do oral surgery? Do I want to do, endodontics, periodontics? You want to make sure the patient population that you have can better suit you as a clinician. So aside from, me feeling comfortable, I also had to think of my professional goals. And when I was at the interview, they said, are you comfortable with treating patients who may come from more low income, so to speak, may have more health problems? I'm like, absolutely, I am up for the challenge. And that was also important to me, was to make sure that dental school is expensive. We want to make sure that we're getting the most out of our education. And Detroit Mercy completely checked all the boxes for that.
Those are all fantastic points. Did you show interest in Detroit Mercy beforehand, or like any pre-dental events, or reach out to the professors and students?
Yes, I did actually. So in New York, I was a dental assistant, but I was also a dental assistant for Colgate. And we have a program called Bright Smiles, Bright Futures, which is a mobile dental clinic where we go, to the different boroughs of New York. And we do free dental screenings for pediatric patients, because, good dental habits start at a young age. And one of the sites that I was at and the doctors I assisted under was actually a Detroit Mercy alum. And then he told me, he said, we also have this type of program in Detroit Mercy, because Detroit Mercy is very big on outreach, very big on community. So he said, you're here, you might apply to the school. And that was the first time I heard about the program. So through him, I started doing more research on the school. And in New York, we have an annual dental meeting called the Greater New York Dental Meeting, where dentists from all around the country come and they give CE credit and lectures. And I looked at the brochure and I said, okay, this dentist is from this school and that school. And they actually had a Detroit Mercy table. I was able to network with doctors or alum that are retired now there, and they all vouched great things. So that was my kind of lead way into the program, because I've never been to Michigan before. I've heard of Michigan State Dental School, but I've never heard of Detroit Mercy. So it was really nice to hear a different perspective, and nicer to know that I found out about the school doing something I loved. I love outreach. I love giving back. So to find a program while I was doing outreach and knowing that their mission aligns with my own was important. So that's how I reached out to the program.
That's awesome. And would you say that, every pre-dent should research the school that they want to apply to by doing that, by reaching out to alumni, professors, and students?
100%. You have no idea who you're going to meet, and you don't know what they can do for you. And also, they've been to the program. So, a program may look good on paper, but you also want to talk to different people, see how they're like, because, you know, when you speak to someone, you can think, okay, like this is a very, you know, outgoing, nice person, and maybe I am that too. And you want to see if you fit there, because again, you're spending 4 years in the dental program. You're going to want to love to be there. That is your family. I speak to my sim lab instructors more than I call my mom. So it's very important to say like, hey, like go on Facebook, go on Instagram, look for events, go on the school's calendar. Actually, sometimes they have different pre-dental days. So there's a lot of impressions days that are virtual. There's a lot of online shadowing that you can do now. But for the programs you are interested in, what I will say is we were all pre-dents before. That's the common denominator of all of us. We all know what it's like to be a dental student. We all know what it's like to have the DAT looming over your shoulders. So paying it forward is something that I love about this profession. When I was a pre-dental student, I have never met a dentist that was never willing to help. I have never met a student that was never willing to help. So you just kind of need to get out of your comfort zone a little, because sometimes I was very, as much as I like to talk, you know, when you think about your professional life, you start to get scared. You're like, oh my God, like they got into school, I want to be there. But they are just as human as you. And I could have a million messages on Instagram from students that are going to UDM, and I will answer every single one of them, because it's free information. So why not?
That's what I love about the dental community. You were spot on. Everyone is so willing to help, and even
Ab-
as just as a pre-dent, like you can see it, like dentists, professors, you know, dental students, everyone is willing to like give up some of their time to, you know, help you succeed in this career.
Absolutely. And I think it's because like attracts like almost, you know, your dental family, I said, becomes your immediate family.
Yeah.
And who would not want to work in a profession that's very interconnected? You
Right.
know, you don't, you know, and it doesn't just stop at dental school. When you exit dental school and you start, you know, your own practice, or you work as an associate for a practice, and you're like, oh, I went to this program, I'm alum of this program, can I have a referral here, referral there? If there is any facet that I really improved on as a pre-dent, I'm still improving now, is just the ability to talk to people, to network, because you don't know how someone can serve you, and vice versa. Because a big thing with being a mentor too is you help me as much as I help myself,
Mhm.
because you guys are the future of dentistry and potentially my colleagues. So why would you not want, you know, it doesn't stop. I'm the class of 2024. There is a class of 25, 26, 27, 28, 29, and
Yeah.
there's going to be a point where I will retire. And I want to make sure that for the integrity of the profession, that we're bringing in people that are like-minded. And that's why I feel the community is so close-knit and so open to helping, because we really just kind of want to, you know, take over the world. I think that just want to take over the world kind of. So.
That is so well said. I love that philosophy. Like you couldn't have said it any better. So now I'm curious, how has your transition been from being a pre-dent, you know, finally being a D1 in dental school, and like how has COVID affected that?
Absolutely. So for me, I did take a gap year in between undergraduate and dental school.
Okay.
So something that was a little challenging for me, not in return in terms of COVID, was adjusting to studying again. You know, because you graduate, you take a year off, and you're basically the only thing I studied for before dental school was the DAT. And then there was a big time in
Mhm.
between that. So it's weird, because you go to high school, right? And they say what you learn in 1 year in high school, you learn in 1 semester in college.
Yeah.
And then you get to dental school, and what you learn in 1 semester in college, you're learning in 1 week in dental school. So it's just an influx of information, which is why if you are a pre-dental student, I encourage you to take those upper level electives in your program, because taking microbiology, taking immunology saved me in dental school, because all of that will come back. So I would definitely say getting into the rhythm of studying, finding my own study method was difficult for me, just because I took the gap year. I know first I could imagine if I went straight from undergrad to dental school, I may have retained like, okay, like, you know, I had a little bit of break, but let's get back to it. But I had to start from scratch after not being in school for about a year and a half. In terms of COVID, what I will say is I am the students who I actually think, I'm trying to be careful of what I say because I don't want to say it benefited me, but
Okay.
I like the online, being at school online,
Yeah.
because the only time we are at school is for sim lab, which is great, but I like watching my lectures on two. It saves money on gas. You know, I'm not, you know, commuting back and forth between having a class at 11 and then my next one at 4 o'clock.
Yeah.
I still feel too, I don't feel like it affected so much because in undergrad, if I was looking at a lecture, I would have to go back and reread it anyway. It was just nice to have everything recorded at my disposal, everything nice on Blackboard and things like that. So I prefer to be at home and watching the lectures at my own pace, making flashcards at my own pace versus sitting in a lecture hall where I feel like I'm passively learning something. And then I know students who need to be in the classroom, and that's great. Everyone has a different learning style. So maybe a colleague of mine may say different and say, oh, I do like being in class. Like, I want to be there with my professor. For me, I like to be in silent. I'm a very silent studier. So I
Yeah.
like to in my zone and lock in. And I feel like having all my lectures recorded for me, everything online, really gave me a fluid way of approaching my studies.
That's very great. Yeah, I mean, I agree with you. There's some advantages to being online.
Yeah.
Like you get to be in the comfort of your own home, and like you can
Yeah.
just stay in bed and like watch lectures and do your work. Yeah, for sure. So
Yeah.
what's the average day looking like for you right now? Are you guys hybrid or is it all online?
We are hybrid
Okay.
since the that's something that I'm very grateful to the program for. They told us at orientation that they want to do the best by us and not compromise our dental experience, so to speak. So since first year, we've always been in sim lab at least twice a week, and then we have practice time on the weekends to practice you know, whatever else that we may feel like there's a deficiency in during the week. But all of our didactic courses are online. They range from as early as 7:30 and go to as late as maybe 6:30 in the evening, but not that whole day. They'll kind of be blocked in different times, which is why I like it being online, because I wouldn't want to go to school at 7:30 in the morning to have
Yeah.
my next class. So that's basically what it's like. So didactics are online and SimLab is in person.
Okay, that's great. So you feel like the school is still keeping you at like the high standard of like the pre-COVID era, right?
They're doing their best to do that. There's obviously little, this is the first time anyone's living through a pandemic. So they're doing the best that they can to kind of simulate the normal experience so much. So for example, I would say classes that are a little more compromised would be anatomy, because generally you are in labs for that. But what my school has done, we do a virtual dissection, but for our practicals, they take, my professor is actually in the lab at school and she takes different pictures of different cadavers, because if I was in a pre-COVID world, if I were to take exams, they would not be on the same cadaver. It would be on different ones. So it's more so anatomy without the formaldehyde smell. Maybe beneficial to some people, but they are trying to make it as rigorous as others. So, you know, a nerve you may study in one picture won't look the same in the other. So it still was challenging. And although I'm probably can't make this assumption, but I think that I would have performed just the same in terms of my grades, because she did make it challenging. So
Okay.
nonetheless.
That's great. So, and how have you felt it's been like trying to get to know your classmates? Because I mean, at least you guys have been hybrid the entire year, so I'm sure you had a better opportunity than most schools, right?
Absolutely. So traditionally, our class, I believe, is of around 140 students, and there's usually a group A and B to kind of separate to keep 140 away. But because of COVID, we have A, B, C, D. So there's 4 groups instead. And that's how they were able to kind of allow us in sim lab, because everyone is very socially distanced. We have around like 3 benches between each group, probably has roughly 30 to 40 students. I would say it's difficult more so because we have to respect the opinions of our peers. So although some may want to meet, some may not want to meet, but it was easy in the sense that we all use a Discord or a group me app. So there's a class group chat. And I feel because, our generation is very social media active, that the only thing was missing was meeting each other in person. But now with the vaccine being offered, we're able to kind of talk a little more. But what I will say is I never felt isolated from the beginning. Everyone was always so welcoming and nice. And again, back to my interview, that was what the admissions were screening for. So once, despite not being able to see each other really for a few months besides your elected group. So for example, I'm in group D, so I only ever see group D students. On the chat, we were all one synchronous family, so to speak. So I don't feel like it was completely jeopardized. And as you said, I do agree that we had a little easier because we were still able to kind of see each other in person. But I feel a lot of dental programs, they may also have their respective group chats and things like that. But what I also would say too is the environment of the school is very family oriented. Like nobody is out here to kind of one up another. I would say competition is at 0. Everyone is helping everyone. I've in sim lab, like if my tooth pops out or if I drilled the wrong one, I need something, I've never hesitated to ask another student for help or faculty. That's another thing that's very important, very, very, very important as a pre-dent. Reaching out to students that are in a program is what is the vibe almost.
Yeah.
Is it cutthroat? Do students talk to each other? Are people very, kind of in their zone in dental school, graduating, want to go to residency for a GPR or maybe a specialization? And not to say you can't accomplish that in a family oriented school, but you may want to go somewhere where you feel like you can talk to more people. Because I do know some of my friends who are in other programs who feel like they are just like in their zone, and some students may not want to talk to one another, and that's okay. To each his own. But it's important to, if you are someone who is in need of support and you're in someone who wants to be of a very communal program, that's one way to find out is by reaching out to students, because they're the ones who are going to give you the raw, honest truth about it. And I could definitely attest for you, DM, that even D3s, D4s, I know them,
Yeah.
even I've never met them in person, but everyone is in a close knit with each other.
And what's the class size at UDM? Is it small?
My class is around 142.
Okay, that's a pretty big size then. Okay.
Yeah.
So it's cool that you guys are still all close knit. That's really important to me as well. So
yeah,
yeah.
Absolutely.
Has your school given an update on like what it's gonna look like in the fall? Are you guys gonna be like all in person, hopefully, or still hybrid?
Right. Thank you. We have the goal to be in person by the fall for this. So I started my D2 year this week and we're still hybrid, but how they've been monitoring that is every week they send out a COVID update, and every week they send out a survey to see how many people are vaccinated. Also for the comfort of the student. Like I said, the school really cares. So they want to know, like, as a student, vaccinated or not, are you comfortable with coming to campus? Are you comfortable? Because, a lot of students, we're not just, have kids. A lot of students have different lives. So you may not want to expose or chance the exposure. What I will say is that's how they're going to make their decision. But the consensus is by fall, we may all be in person, especially a big factor in that is the law of the state as well. But we've been doing pretty well, and I've received emails where we may potentially be fully in person by fall.
Hopefully.
Yeah.
All right, well, that'll be it for this interview, everyone. Tavee, thank you so much for your time and for your advice. Like, I really appreciate it, and I know our viewers will as well. Um,
Absolutely.
if our viewers have any additional questions for you, is it cool if they reach out either through
One
Instagram or email?
1%. Through this, my Instagram handle will be there, and please blow up my inbox. Please just ask any questions, whether it's mitigating. Again, just bringing mental health awareness, mitigating having a chronic disorder through dental school, mitigating just general thoughts, how to study, being a student that was working full time and trying to work through schedules. It doesn't have to just be a technical, hi, I'm a pre-dental student and we're cool. Like, just ask me anything you need to, because it doesn't have to be that formal, because life is holistic and we want to make sure that we're taking care of each other and all across the board, not just teeth,
Super
you
well
know?
said. Super well said. Everyone, you heard her. Blow up her inbox. All right. So for you guys at home, if you haven't already, make sure to hit the subscribe and like button and hit the notification bell if you want to be notified when we upload new content. And if you have any questions for us at FutureDDS, you can just DM us on Instagram at _FutureDDS, and we'll try to reply as soon as possible. And until next time, we'll see y'all then.
Have a great day, everyone.